Good afternoon. My name is Cherie Sims. I want to speak with you just for a few moments regarding our quality improvement project here at Goodwill Healthcare Clinic. We have made the decision to convert to an electronic health records messaging system in all departments, and we are currently encouraging buy-in from all physicians and healthcare professionals. This change has been agreed upon by management to facilitate effective communication between healthcare providers and eliminate call intake duplicity and ultimately reduce medical record errors. The core function of an EHR is to collect clinical data regarding patients' labs, test results, medications, and allergies. And the EHR should provide data from the past and current visits to all clinicians providing care in any setting for that patient. An EHR should allow the clinicians to enter and store orders for prescriptions and other services in order to enhance legibility and reduce duplicity. One of the severe problems is consolidating and eliminating duplicity of documentation in all departments. This challenge occurs when the information must be documented in two different areas. Currently, the call center will document on paper and then transfer the information into the record electronically while continuing to file paper. Goodwill Care Clinic is wasting time and money with this data duplicity. We must ensure these records are updated. It will give greater physician access to real-time data and eliminate areas of potential medication and allergy concerns. Regarding the EHR change process, not all departments are utilizing the components of the EHR system, which leads to employee frustration with added workload. Some of our units in the organization use paper records for messages and notes. So there is some resistance from physicians and healthcare professionals, which is affecting our organization. Every unit records their office visits into the EHR, although not all are utilizing the components of the current EHR system. And this can be very dangerous because it can lead to loss of data, which produces non-response from a physician, or allows for no follow-up to the patient. Decision support not only serves as a tool of enhancing clinical decisions, but also acts as improving patient population health. The tools of patient support allow the patient the ability to access their health records while ensuring they are taken care of while they are sick, offers additional education materials, and even allows patients to conduct self-testing prior to meeting with a physician. Some of the proposed risk analysis strategies. Data collection should be completed by reviewing documents and reviewing past projects. After collecting the data, an organization should identify suspicious threats to data, assess security measures and rules, and ensure that measures are implemented to reduce risk in each department for each employee. Our organization is required to look at risk probability for electronic patient health information. These results, combined with the initial list of threats, will determine which threat requires protection first based on anticipation. Determining the potential impact of a threat occurrence can be a combination of different factors, not just one single factor. We should assign threats and vulnerable combinations that we find to a risk analysis, such as physical safeguards, administrative safeguards, policies and procedures to protect against technical safeguards. Even with a certified EHR, we must conduct full security risk analysis requirements to ensure we are maintaining and protecting our information. Important steps in the implementation process will be to tailor the system in such a way to achieve the requirements. We must establish a change management process and determine the means to back up medical histories. Throughout the process, it will be important not only to support the software, but to encourage the staff through the learning process. The goal here is to make electronic access and documentation of health information more effective in our process. The entire project should be completed in less than 6 months and provide efficient review and communication for patients and staff. We must continue ongoing maintenance and software updates as well. As technology culture changes, patients can call and make an appointment regarding their sickness or concern. However, complex patients are those that suffer the most. As sometimes care transition from the hospital to home, they are at risk of readmission. Those that receive quicker follow-up appointments are more likely to be compliant, as they feel they are not being left behind. So our primary care offices will automatically receive a notification when a patient forgets to make an appointment quickly. The provider will then contact the patient. As it relates to different areas of delays in primary care and mental health, we are looking to improve care and efficiency leads to reduce overall errors. Patients can obtain a more efficient service, and they have the ability to review their records from home. This technology modification will help ensure real-time information is being shared and reviewed, and healthcare is delivered effectively. The main function of leadership will be to facilitate this process. Patients will be notified with easy-to-use information. We must engage experts so that we can improve our coordination of quality and improve efforts. We must continue education through public awareness. We must continue staff communication and ensure that advanced policy changes are done at the same level. Collaborating with key stakeholders can ensure that all areas are successful in the process implementation. Enterprise-wide data role, also referred to as information governance, is an approach to managing data that allows organizations to balance two or more needs. First, we must collect the data and secure information. Health information technology strategies and governance are core components of any healthcare organization. The significance of setting up the governance process is to ensure guidance, support, and data integrity. The aim is to ensure that the EHR system is implemented with proper data management in mind. There are specific challenges that are identified and specific goals and objectives that must be put in place for our team. These aspects will specifically be beneficial in allowing the staff to comprehend the necessity of the new EHR. Having these data governance policies and practices helps in facilitating the achievement of our institution. Identification of matching patients' information is a constant worry in the healthcare industry. So we want to ensure that we're giving matching multiple demographic elements, such as birthdays and addresses, the appropriate provision. This is done when we establish data governance and best practices. Data governance helps in supporting patient engagement strategies for healthcare organizations. Technology has improved the way quality is measured, how it's managed, and delivered for better patient outcomes. Data governance refers to the structures, roles, and policies that organizations establish to manage information and ensure accountability. By proactively identifying our quality issues, our organization has the opportunity to address these concerns before they become costly. We can make sure that we are well documenting our workflow, and our stakeholders hold a responsibility for the quality of data. Another role that the government plays is to ensure that there is consistency in our data management. By using EHR in an organization, we'll see savings over time due to a more efficient process requiring less paper chart review. The use of EHR also helps in increasing revenue, allows for easy analysis of charts, improved coding and accuracy, as well as additional charges to be captured. So we ultimately will have fewer lost charges due to incomplete documentation. There are cash incentives to those organizations that are adopting a complete EHR system. Lastly, patient satisfaction will increase as follow-up is quicker and patients are able to view their medical information prior to speaking with a clinician. This added element will bring about the greatest marketing tool, which is word of mouth regarding ease of service delivery. So some of the questions that you might be asking are some of those that we are trying to address. And one of the biggest challenges that we are likely to face, we're currently working on, is security. As we move forward, we become more of a presence digitally. We must ensure that our data is secure and there are no opportunities for this information to be unauthorized. If the system is unable to contain the information when transmitted, data breaching can occur. The process is quite effective and it has been enrolled in different areas of our world, which brings a great deal of help to these healthcare organizations. An individual is able to not only book an appointment online, but they are able to send a quick instant message for follow-up. For those patients that have concerns about leaving their home, telehealth is currently an option. Lastly, how do we intend to address those members that have not bought into the software change? Through communication. We want to allow the departments that have already implemented these components to speak with those that are concerned, to show the advantages of being able to document in one system. Not only that, but to bring about awareness regarding patient satisfaction and the benefits that can have a great impact for our organization. So again, the main function of leadership will be to help facilitate this process. It is crucial for our team to ensure that the policies and procedures are carried out and the required resources for this project are readily available. One of the most important policy modifications will consist of ease of use and patient information safety. It is important for our leadership team to ensure that adequate training and ongoing education are a part of this process to build staff confidence. Patients will be given instruction sheets on how to access these new tools online and information regarding communication electronically. The central strategy entails standardization of data collection, accessibility, all of which will improve patient health outcomes. The challenge will be staff resistance. However, through a comprehensive approach, success can be achieved with this project. Thank you so much.